How prepared is South Africa for a possible Ebola outbreak? And how did Ebola spiral out of control in West Africa? What impact does Ebola have on the economies of African countries? And is the World Health Organization losing the battle to contain this disease? What time is it? It's question time. Hello and welcome to the show. My name is Mpotsi. The World Health Organization reports that the Ebola epidemic has so far claimed over 4,000 lives. This is since its outbreak earlier this year. The disease has indeed reached alarming proportions, and the harsh realities of its impact are already being felt, particularly in the worst affected Liberia, Sierra Leone, and Guinea. While continental and international organizations are grappling with a variety of interventions, the economies of these countries are under severe threat. To compound matters, several countries abroad are reported to be screening travelers from these three West African countries. But how justifiable are these actions? My guests today are Stephen Smith, the health attaché from the USA Embassy in South Africa, and Professor Lucille Blomberg, the Deputy Director at the National Institute for Communicable Diseases. Let me welcome you both to the show. Prof, let me start with you. 8,914 reported cases, 4,447 deaths so far reported. What's the latest?
That the outbreak is really out of control. And I think we're seeing increased numbers of cases every day. And we're going to need a coordinated, tremendous response, particularly from the international community, to bring this under control.
Who are you referring to by the international community?
I think it's countries that can bring resources, staff, expertise, and physical resources, protective clothing, set up of treatment centres to the outbreak intervention to support control.
South Africa has tried its bit.
Yes, we have a laboratory on site in Sierra Leone near Freetown that is doing diagnostics for Ebola to support a treatment centre. And this is the second rotation of staff who are there, and we're hoping that this will continue. It's a very important contribution to outbreak management.
And of course, the USA has also deployed how many troops? 600?
Well, we see this as a priority and out of control, and we want to get ahead of the epidemic and control it, contain it in West Africa. So we've had hundreds of experts in country for some months now. These are epidemiologists and disease control experts. Yes. But we've realized it's gotten ahead of us. So now we are deploying the U.S. military, and we're expecting to deploy up to 3,000 troops. So we're really looking at a very significant response because this is a crisis.
Are you not doing so because there's proof that one person died in the USA because of Ebola, despite all the measures that you may have? And I'm now talking about your border control systems and all that.
We are working at home and abroad. But if you look at the timing of our response, the U.S. was in Liberia, in Guinea, in Sierra Leone months before there was any outbreak in the United States. And in fact, President Obama announced the robust response, the military response, about 2 weeks before we had our first case in the U.S. So we are looking to save lives, to contain this outbreak. The fact that we have a case in the United States has raised the attention, but it isn't really what's motivating our response. Our response was already there.
And there seemed to be this misconception of where in Africa this problem is. And one of the tourism agents who is based in the USA was saying there's a lot of postponement, not necessarily cancellations though, because people don't seem to know in the USA where are the areas that are affected by this epidemic.
What we have is two epidemics. We have an outbreak of Ebola,
yes,
and we have an outbreak of fear. And really the outbreak of fear is much more widespread than the outbreak of Ebola. And that fear is across Africa, it's across the world. So we have to really educate and talk about that outbreak of fear, as well as figuring out how to contain the outbreak of Ebola.
Prof, what makes this one the worst of them all? I mean, it was firstly noted in 1976, 78? Yeah, 76. But this one, yes, in the Ebola region, and I understand that's where the name Ebola comes from.
From the Ebola River.
Yes, Ebola River, that is. Now, what makes this outbreak the worst ever?
Well, it's taken place in countries that have not previously been affected and haven't had experience of responding to outbreaks. There is a current outbreak in the DRC which is unrelated to the one in West Africa, and it really is coming under control quite quickly with tried and trusted control methods that do work. But in West Africa, it's their first experience in these three countries. It's a very mobile community, so there's a lot of travel between the border areas of the three countries, so it spread quite rapidly from Guinea, where it started. These are very poor countries with very poor infrastructures, particularly health. There's a lot of misperceptions, and the tried and tested control methods did not work or weren't accepted. And before you know it, you've got a huge outbreak that is much more difficult to manage. It needs huge resources.
Is there enough regional collaboration, though?
Well, I think a lot of the countries around these three countries themselves have limited resources. So, the international community have to support this outbreak. It is way beyond any capabilities of the region. And
perhaps let's look at, maybe let me just come to you, the effect this has had. You've spoken of the outbreak of fear and the outbreak of Ebola. Have you noted any significant impact on travel arrangements as well?
There are a number of countries that have put in travel restrictions of various kinds, and then there's a lot of voluntary restrictions. People are afraid to come to West Africa. The effect, the projected impact on the economies, particularly the highly affected countries, is profound. They're talking about essentially no growth and billions of dollars of economic damage. And it's going to ripple much more widely than just this one area. People are afraid to travel. People are afraid of Africa. People are afraid of a lot of things. Yeah, but that's the problem now, because Americans just think that Africa is one little village. I mean, you go to Northern America, let's just take Massachusetts, for instance. Somebody lands you from South Africa. Like, I've got a friend in Kenya. I wonder if you have met him. So I think there's a lot of education which you need to do amongst Americans to say Africa is actually a continent, with 52 plus states, Somebody, I live in Johannesburg. I don't even know somebody who lives in, perhaps 3-kilometer radius of where I am, So I think there's a lot of misconceptions there as well. But one or two things we do know. We live in a globally connected world. And even if there's misunderstanding about where the outbreak is, there is risk. And so we have to do what we can to contain the outbreak in West Africa. And we know what to do. Isolate the cases, treat them compassionately and protect the health workers, do the contact tracing that's necessary, properly bury people and dispose of waste. This is tried and true public health. We've done it before, and we can do it again. Unfortunately, in this outbreak, it has gotten ahead of our response. So now we have to increase the response to get ahead of the outbreak.
Prof, I'd like us to talk about the misconceptions and the myth about Ebola, but only after the break. Okay. This question time, please don't go away.
Zoom into Africa. This is Namibia, The president is Mr. Hifikepunye Pohamba. Namibia got independent from South Africa on 21 March 1990. The population is over 2 million people. One of the major languages spoken is Afrikaans. Monetary unit is the Namibian dollar.
Welcome back. You're still watching Question Time. My guest today is Stephen Smith. He's the health attaché from the USA Embassy in South Africa. And Professor Lucille Blombeck. She's the deputy director at the National Institute for Communicable Diseases. Now, Prof, let's talk about the misconceptions about Ebola.
So I think the major one is how it is spread.
Yes.
And how it is not spread.
Yes.
So it is spread, you find the virus in blood, feces, and vomitus of infected people who are ill.
Okay.
And that spreads to people who are looking after them and have very close contact with them, with those with blood, with vomitus, and with feces, without protection. Bare hands, they may rub their eyes or noses, as we normally do, and it's, in that way it's transmitted. So it's people caring for patients in the home setting, or healthcare workers caring for patients without protective clothing. That's the kind of close contact you need for transmission. It's not from casual contact. You cannot get it from somebody who has no symptoms but may be infected and may get ill next week. And it doesn't spread through the air. Diseases that spread through the air are like influenza or flu, measles, TB. That's not the way Ebola spreads.
How do people prevent it then?
So it's really about providing protection, protective clothing to health workers, good training, and making sure that they use the protective clothing, the gloves, the gowns, the goggles properly. And they not only wear them properly, but when they take them off, they do it in a very careful way. And you've heard about a couple of health workers who've been infected despite wearing this protective clothing. So it's usually because they happen to just scratch their nose, and the nose, the eyes, the mouth have a mucous membrane that's quite easily the virus can go through. And we do that kind of reflexly. Or when they're taking off the protective clothing, they're not doing it properly. And again, they will expose themselves.
But when you look at the symptoms, they look like flu symptoms: fever, weakness, muscle pain, headaches, sore throat. Well, external, internal bleeding, yes, does sound a bit off. How do you then know that what you have is Ebola, what you have is not Ebola? It's just ordinary flu.
That's the difficult part if you're working in the area where the outbreak is occurring. So you take the history of where is somebody living or where have they traveled, plus the symptoms, plus the risk of them having been exposed. They cared for somebody in the hospital or in the home, or they assisted somebody who collapsed, who had the disease. So it's not just the symptoms alone, it must be linked to having traveled to the area and been exposed to someone else with the disease in that area in the way that I've described.
Have you, and by you I mean the USA, if you had to turn people back because they tested positive?
So we have now some additional screening coming into the United States, but the main protection, the main screening actually happens at the ports of exit when the people are getting on the planes. And they get screened actually multiple times in West Africa to determine if they're contagious, infectious, and they don't get on the plane. And then if they do come...
Have you had such instances?
In West Africa, absolutely. There have been people who have not been able to board a plane. But then we have just instituted some additional screening in the United States for a limited number of passengers, and we're doing fever screening and identifying anyone who is at risk of Ebola.
Have you not been accused of racism?
You know, there clearly are opportunities for, again, the fear to motivate some behaviors, but that's not what this is about. This is a public health response. We're trying to evaluate with the best scientific methods we can who is at risk and who's at risk of transmitting Ebola. And that's what the screening procedures are about.
Yeah, but like you've said, I mean, there are opportunists there who may just say, who may not actually think or even want to look at the fact that this is about containing a very serious problem, which, if left unattended, can actually wipe the entire population that side. But they may start to, throw all sorts of allegations and accusations. I mean, the USA does not have the best history when it comes to race relations, coming, some years back. But are you not at that risk?
Well, let me just take issue with one thing you said, which is that we are looking at the potential for this essentially sweeping through the United States. I think that's very unlikely. In places that have strong health systems and that have public health responses to contain and do the contact tracing and the other public health measures that we've talked about, it's very unlikely that we will have widespread transmission.
Okay.
So what we are trying to protect against a limited number of cases. In cases that have weaker health systems, or you get the outbreak in an urban area, then you get more widespread transmission. And that's what we're seeing in West Africa, which is why we need a more robust response in West Africa.
Are you going there to provide aid in the sense that you have noted that those countries, some of them are not as economically viable as, perhaps a country like South Africa, for instance, because one can't help but think here is another African state going to the USA with cap in hand to say, please come and help us.
We're going there to save lives. That's really what we're doing. And we are trying to contain this outbreak before it becomes a bigger problem for West Africa, for the rest of the world. That's our goal in this enhanced response.
Can I just say
yes,
that there is a humanitarian, health and economic disaster unfolding in those three countries. And it is critically important that the international community come to this outbreak and support the response. Those countries cannot manage on their own. It's beyond anyone's resources in that area.
Let me just add on that we, from the President of the United States on down, have been working very hard to galvanize the international community in their response, because we, as public health people, recognize that we are falling behind. We need a more robust international response. Everyone has to contribute. And we're seeing more contributions now, but we need to see even more. They need to be more rapid. They need to be sustainable. And that's what we're looking to get going, but we can't do it alone.
Okay. We're going to talk about the World Health Organization as well and its role in this only after the break. This is Question Time. Please don't go away.
Technology is all around us and is improving lives across Africa, like how young Nigerians are connecting to the internet. There are doctors finding new ways to save lives in Cameroon, and the South African public transport system that is now getting Wi-Fi. We have gadgets, apps and loads more, some of which play a big role in Africa's growth. A huge part of this African growth is technological innovation. To find out a bit more about social media and technology news from here in Africa and abroad, join me, Siphumelele Zondi, every Sunday at 7:30 p.m. on SABC News.
Are you fled to Canada?
Those two kids.
No people. Ik geloof mij, ik is een kaps. Ja, ik heb een paar bezig.
Welcome back. You're still watching Question Time. My guest today, Stephen Smith, the health attaché from the USA Embassy in South Africa, and Professor Lucille Blombeck, the Deputy Director at the National Institute for Communicable Diseases. Now, the World Health Organization have just announced that there's an operation center which is going to be opened or launched. I think it has been opened already.
It's in process.
Oh, okay. Just talk to us about
So it's
that.
really, I think what this outbreak needs is intense coordination.
Yeah.
So many countries have come with many different interventions and support.
Okay.
But it's important that this is coordinated so there isn't duplication, that people work together and that there aren't gaps. And there's a coordinated outbreak response. And WHO has a very important role to play in that.
Are they doing enough?
I think, they're doing what they can. They certainly can't do it alone. WHO does not have those huge resources that are needed. And so it's important that everybody comes to support this outbreak, as we've mentioned.
Well, America is there. They do have quite a big pass. I'm sure they
But
can
other countries are also there, and every bit of help is needed in a coordinated way.
What do travelers who have to make some inevitable trips to that region have to do?
Well, you can protect yourself. You certainly do the basic public health, wash your hands and be careful of your environment. But you also then will have to go through certain levels of screening when you want to exit the country. And you really want to be sure that you're not exposed, or if you are exposed, you want to make sure that you then monitor your fever or potential fever for 21 days and not become someone who transmits the disease.
So I want to add to that.
Yes.
So most travelers who go to those regions are involved in various industries, the mining industry, the retail industry, the security
Agriculture,
industry,
yes.
and a few will be involved in healthcare industry supporting the outbreak. So those, the miners, the other travelers, do not have the risks of Ebola. They're not going to be exposed to vomitous feces and blood of patients because they're not caring for them. So their risks would be negligible. What they do need to protect against are other diseases that are common in the area, like malaria, so that when they get a fever, there isn't this confusion and panic that you've been in West Africa and everybody goes Ebola, and it's much more likely to be malaria.
But you can't get Ebola through mosquitoes.
No, but malaria is common in Africa, so they're not going to get Ebola. They can protect themselves very easily because they're not exposed. But there are other diseases that can be confused with Ebola that might be a problem when they need to be treated or travel out of the country.
And let's talk about vaccination. At what stage is the world really, in as far as the availability of a vaccine?
So there is an experimental vaccine.
Yes.
It is currently being tried in healthy volunteers. There's a study in Mali, also in the United Kingdom and the United States, to see the safety of the vaccine. It's not previously been used in humans. It's been studied in primates. So I think it's very important to do some preliminary studies to see safety, how effective it is, before you move it into giving to populations to protect them in the outbreak or between outbreaks.
What happened to those Americans who tried the other one, ZMapp?
So ZMapp is an experimental therapy. There were very few doses. Some of the people who received ZMapp survived, and some of the people who received ZMapp did not survive. So we do not have enough evidence to determine the effectiveness. We know what to do here. ZMapp and a vaccine and potential therapy, those are things that we hope we will develop. But right now we know what to do. It's a public health response. We isolate the cases. We make sure that we trace the contacts. We treat the patients compassionately. We protect the health workers. We have effective, safe burials and waste management. We do know what to do. We've done this before, and we can do it again. We will get ahead of this.
People are hiding their the dead, instead of burying them. apparently there's a stigma, as perhaps it used to be the case with HIV. I don't know, is that not exacerbating infections?
There needs to be trust between the health workers and the population, and in some of these communities there really is not. And that's something that we have to continue to work on if we really want to get ahead of this outbreak.
You deal with communicable diseases. How different has it been dealing with this one and the others?
Well, it's very different to other communicable diseases. We have a lot of experience in other viral hemorrhagic fevers in South Africa, and we can translate that experience into preparing for any introductions into this country. But I think it's the high death rate, the fears around Ebola, the misperceptions about transmission, and we've spoken about that make it very different and more difficult to manage.
But there are other communicable diseases that are killing more people than
Absolutely.
Ebola.
Yes, I think if you look at the high burden diseases, TB, malaria, HIV, respiratory illness, diarrheal illness, they kill far more people and they're far more easily spread. But I think when you have an outbreak and you have all these dreadful images of people dying in these countries, it really diverts attention away from those. And that's something we really need to be careful about.
What's leading?
What's leading?
Yeah.
I think it depends which country you're in. I think in South Africa, TB, HIV are leading. In some other countries, malaria, diarrheal illness, respiratory illness. Compare the number of deaths from those, it's far, far higher than it is from Ebola. But Ebola captures the headlines, and it's, I think it's out there, it's very fearful, we see terrible images, and absolutely we need to bring it under control.
Is it justifiable, though, the fear?
It's justifiable that we mount a robust response, but there is fear that is beyond the disease. When people are fearful of getting the disease, let's take the United States. There's one case in Texas. There are people thousands of miles away who are fearful.
Yes.
And same here in South Africa. There is no case here. There's no case for 6,000 kilometers, but people are fearful. That's one thing that we need to make sure people understand the risk, and that Ebola is very serious. We need to have a very robust response, but we also have to have a recognition of what needs to be done and not overreact.
What should we expect from the government of the USA?
Well, we are making a commitment. We've been invited in by the governments of Liberia and Sierra Leone and Guinea to come and really provide a response that we are going to continue to provide. That's going to be a sustained response.
Okay.
I think you can expect us to continue that, but we are looking for everyone to partner with us.
Let's leave it there. We've run out of time. That was Question Time for today. A big thank you to my guest and to you for watching the show. We welcome your feedback via email, questiontime@sabc.co.za, or Twitter handle @questiontime24. From me and the crew, have yourself a wonderful time. Goodbye.